Hello everyone and welcome to Module 4. This week we are focused on the topic of cardiology, and with that we're looking at Chapter 46 and then specifically looking at Procedure 46-1, performing an EKG, and Procedure 46-2, dealing with the Holter monitor. So this unit does have quite a bit of information, so I'm going to go ahead and just jump right in. The cardiovascular system consists of the heart, the blood vessels, and blood itself. So let's take a deeper look at each of those individually. The heart is responsible for the movement of blood through the body and providing oxygen as well as removing waste. The heart is a 4-chambered pump in the chest to the left side beneath the sternum. The left and right sides of the heart are separated by a wall called the septum. Then the heart is also broken down from the top and the bottom. The top half is called the atria, the bottom chambers are called the ventricles. The right side of the heart moves blood from the body to the lungs, and the left side of the heart moves blood back to the body from the lungs. The heart also has 3 linings: the pericardium, which is the outer lining, the myocardium, which is the middle layer, and the endocardium, which is the innermost layer of the heart. Blood vessels form a closed pathway that carry blood from the heart to all the cells of the body, and then back again. Blood vessels consist of arteries, veins, and capillaries. So now that we understand that piece of it, and we know what the cardiovascular system consists of, we need to discuss how blood flows through the heart. First, blood from the body enters the right side of the heart through 2 large veins, either the superior vena cava or the inferior vena cava. The superior vena cava brings blood from the head and the upper chest, and the inferior vena cava brings blood from below the heart. The right atrium receives the blood delivered to the heart from the body. From the right atrium, the heart pumps the blood through a valve into the right ventricle. That valve connects the right atrium to the right ventricle, and that is called the tricuspid valve. The right ventricle will pump blood out through the pulmonary vein to the pulmonary artery, which will carry blood to the lungs. While the blood is circulating through the body, it gives up oxygen to nourish the body's cells, and at the same time, it takes on waste carbon dioxide given off by the cells. When the right ventricle pumps this blood into the lungs, there's a gas exchange. The pulmonary vein carries the oxygenated blood from the lungs and it empties into the left atrium of the heart. Blood will leave the left atrium through the bicuspid valve into the left ventricle, which is known as the powerhouse chamber. The blood will then leave the left ventricle through the aortic valve and enter the aorta, which is the largest artery in the body. From there, blood will begin its journey through the various arteries that branch off into different regions of the body and then pump themselves back to the heart through the superior or inferior vena cava, and the process will start again. So now that we know how blood flows through the body, we need to discuss blood itself, its functions, and the different blood types. Blood is a type of connective tissue that is composed of blood cells, or the formed elements of blood, and plasma, which is the liquid portion of blood. The average adult has approximately 5 liters of blood within their body, and there are 3 main types of blood cells. We have erythrocytes, or red blood cells, leukocytes, or white blood cells, and thrombocytes, which are platelets. And blood has three main functions. It's either to transport, regulate, or defend. Transportation means that blood moves from the heart to all the tissues of the body. The blood transports oxygen from the lungs and nutrients from the digestive tract and delivers these to the tissue cells. Blood also picks up waste materials from the cells that is later filtered and excreted from the kidneys, as well as carbon dioxide that is exhaled from the lungs. Regulation, so the blood helps to regulate body temperature by absorbing heat. Blood also helps to regulate the pH balance of the body. And defense. Leukocytes defend the body against pathogens such as bacteria or viruses. When we talk about blood types, this is determined by the presence or the absence of certain antigens and antibodies. Genetics determine whether these protein molecules are present or absent. The ABO blood group system identifies 4 blood types: type A, type B, type AB, and type O. Type AB is considered the universal recipient because they can receive all blood types of the ABO blood type. But type O is considered the universal donor because their blood can be administered to most people regardless of the recipient's blood type. Another piece that we need to discuss and focus on is the Rh factor. This is based on an antigen first discovered on red blood cells of rhesus monkeys. Someone who is Rh positive has a red blood cell that contains the Rh antigen. A person who is Rh negative does not. The Rh factor plays an important role when it comes to pregnancy. If an Rh negative female conceives a child with an Rh positive male, the child has a 50-50 chance of being Rh positive. This means that the blood of the fetus will mix with the mother's, and the mother's body will develop antibodies against the baby's red blood cells. But because of the time it takes to generate the antibodies, the first child would not be affected. Any subsequent children after the first one, the baby's blood would be attacked, and this can lead to a serious condition. But this condition can be prevented by being given a drug called RhoGAM to the mother. All right, and some of the things that you may want to look into are some of the common disorders and diseases of the cardiovascular system, and make sure that you are fully aware of them. This is just a small list of them. Please make sure that you review your book for more information. Now, because cardiovascular disease, or CAD, or coronary artery disease, is the leading cause of death among both men and women in the United States, it is important that we help catch and correct cardiac issues as soon as possible. As a medical assistant, we play a very important role in helping with the diagnosis and assessment of cardiovascular disorders like blood pressure and pulse. When more specific cardiac information is needed, we will perform an electrocardiogram, or an EKG. You also may hear it as an ECG. This procedure records electrical changes in the heart. It was invented by a Dutch doctor, Wilhelm Einthoven, in 1903. When the EKG equipment senses an electrical change or an electrical charge, it is recorded on the readout as either an upward or a downward deflection from the horizontal baseline. Movement away from the baseline is called a deflection or a wave. Upwards is a positive, downwards is a negative. So we need to discuss the polarity and the cardiac cycle so that way you fully understand an EKG. The cells of the myocardium produce electrical charges as a result of polarity, which simply means that there are two poles, one is positive, one is negative. The SA node, or the pacemaker of the heart, is where this all happens because it controls the myocardial polarity. When the SA node initiates electrical activity, the atrial cells become depolarized, meaning the internal negative charge is reduced and the difference in the charge inside and outside is lost. The electrical impulse travels from the atria to the ventricles, and those cells depolarize. As the cells depolarize in the atria and the ventricles contract, and blood is pushed out of the heart into the circulatory system. At the end of the contraction, the myocardium will relax and rest, which is known as repolarization. This depolarization and repolarization represents one heartbeat. So now let's understand how to actually read an EKG machine and a EKG printout. You may never have to do this, but if you do, I want you to have a good baseline. A normal cardiac cycle is traced on an EKG as one set of PQRST waves. The P wave represents atrial depolarization or the contraction of the atria. The QRS complex represents ventricular depolarization or the ventricles contracting, and the T wave represents repolarization or the preparation for the next series of complexes. This again is every heartbeat. Now the last piece to an EKG is understanding sensor placement, and this is really important for you as a medical assistant because this is really your role. The EKG machine records the cardiac cycle through 10 sensors or electrodes that are placed on the patient's skin. However, when we do this, it's called a 12-lead EKG. There's 10 sensors, but there's 12 leads altogether. The abbreviations are RA for right arm, RL for right leg. This sensor serves as an electrical reference and does not actually get used in the recording. You have LA for left arm and LL for left leg, and then you have numbers V1 through V6. Now, because this is a medical assistant's job, we also need to be able to prep the patient. This means that the patient needs to remove any and all jewelry on the chest area. That will include necklaces or any sort of piercings that are there. They need to remove clothing from the waist up, but we offer them a gown to keep them modest. Most men have no problem taking off their tops. It's more for the women. And if they do, try to have them keep the opening towards the front so we can still keep them clothed, but also at the same time get to where we need to. Patients need to lay in the supine position. If they struggle with that, you can put them in a semi-Fowler's or even a Fowler's position if they can't lay flat in a supine position. If the patient has a hairy chest, we do need to make sure that we either shave the area or make sure that we can move the hair out of the way to get the sensor to the actual skin. If the patient has any oily skins or skins that have a lot of lotion on them, we will need to wash that area with alcohol. And then in this picture, you can see where V1 and V6 go. Those are the chest leads. They will surround the heart. This is also going to be placed in the lab so you can see it as we actually perform the EKGs this week. Now there's so much more to this chapter and going into the understanding of artifacts, evaluating an EKG, and some special procedures. But I want to leave that for you guys to actually read so that way you have good lab notebooks and you are ready for the lab. That is all I have for you guys. If you do have any questions, please make sure that you reach out to me. Otherwise, I look forward to seeing you Tuesday morning. Bye, everybody.